Classification of labia majora flaccidity and treatment guidelines. Patients frequently show up to our practice with changes in the anatomy of the outer lips, mostly due to sagging. Therefore, it is important to set up a classification. Why classify? Because it makes the study organization and planning easier, allowing us to use the correct form of treatment for each type of flaccidity, and to consolidate the criteria for both research and clinical use. The patient is, of course, along with the classification, important in building the guidelines for treatment. Younger patients with apparently normal lips will generally seek additional volume or fuller lips, since that may be their ideal image. The opposite happens with patients who have been pregnant or who are getting older, where they experience floppiness, fat loss, and the onset of skin folds. Even though it is one of the most frequent inquiries in cosmetic gynecology, current literature usually touches on the location of sagging only in terms of abdominal, facial, arm, thigh, and breast flaccidity. Very little is said about its presence in the vulvar area. It is important to know that the sagginess can be skin-related or muscular. In fact, in this case, it is largely predetermined by a dermal floppiness and a loss of its supportive tissue, like with subcutaneous fat. This way, by being aware of what has been altered, we can work in the area with more confidence. As a result, we are afforded greater success in the treatment with a lower chance of unwanted results. Over the years, all layers of the skin go through a series of changes in their structure, which cause a loss of tone and tightness. There are internal factors such as decrease of flow in the vessels that supply blood to the skin, hormonal changes that reflect a change in texture and appearance, like menopause and pregnancy, free radicals that harm the structure of the skin, collagen and elastin fibers which prop up the skin's support matrix subside, the hold between the dermis and epidermis and its different components, including subcutaneous fat, decline. External factors: depilatory waxing, tight clothing, weight loss, especially when done over a short time frame, particular diseases. What should the evaluation of this patient be like? We must take into account the discomfort the patient speaks of: lack of volume, asymmetry while standing or lying down, and saggy skin, as well as what we observe during the clinical examination. She must first be evaluated while standing, where we will observe the way the outer lips fall and if there is any asymmetry. Then evaluate in the lithotomy position, assisted by a mirror or colposcope. Afterward, you can both determine the most suitable treatment. We may find that by evaluating while standing, we'll note an important stretching of the lips, and being in the lithotomy position, we can only see a mild level of flaccidity. Or that, on the contrary, standing doesn't show great sagging, like in this case, but in the lithotomy position, we can see major flaccidity. The vulva is divided into three parts: the upper, constituted by the mons pubis, the median by the outer lips, inner lips, clitoral hood and clitoris, and the lower and vestibular by the perineum and anal area. The halfway point for the outer lips is framed at its upper part by the base of the clitoral hood or symphysis pubis, on the sides by the inguinal folds, and at the underside by the posterior fourchette or fork. Based on this, we move on to classify and employ the Pelosi pinch test. The Pelosi pinch test assesses the level of flaccidity, subcutaneous fat, ptosis, and pliancy of the outer lips. The technique entails the use of your thumb and index fingers. You pinch the skin and subcutaneous tissue of the outer lip along its halfway point, and you lightly stretch the tissues while pinching. Alternatively, you could use 1 or 2 atraumatic clamps instead of your fingers. The clamps tighten on the skin and subcutaneous tissues and softly stretch them towards the examiner. From there, we classify as follows: normal grade, the characteristics, hard to pinch or stretch the skin and subcutaneous tissue of the outer lip. Grade 1, minimum pinching of the skin and subcutaneous tissue, and they will only stretch as far as 1 centimeter. Grade 2, moderate pinching of the skin and subcutaneous tissue, and they will stretch to a maximum of 2 centimeters. Grade 3, major pinching of the skin and subcutaneous tissue, and they can stretch to a 3 centimeter maximum. Grade 4, extreme pinching of the skin and subcutaneous tissue, and they will stretch as far as 4 centimeters or more. Classification of labia majora flaccidity. Grade 1. Mild laxness without drooping of the outer lip skin. Minimal subcutaneous fat loss and absence of lines or skin folds. Grade 1 pinch test. Minimum pinching of the skin and subcutaneous tissue, and they will only stretch as far as 1 centimeter. Grade 2. Minimal laxness or drooping of the outer lip skin, which does not reach the fourchette. Moderate subcutaneous fat loss with the onset of lines and skin folds. Grade 2 pinch test. Moderate pinching of the skin and subcutaneous tissue, and they will stretch to a maximum of 2 centimeters. Grade 3. Moderate laxness and drooping of the outer lip skin, which reaches the fourchette. Significant subcutaneous fat loss with the onset of lines and skin folds, which may or may not be deep. Grade 3 pinch test. Major pinching of the skin and subcutaneous tissue, and they can stretch to a 3 centimeter maximum. Grade 4. Maximum laxness or drooping of the outer lip skin, which goes beyond the fourchette. Advanced subcutaneous fat loss with the onset of lines and skin folds, which may or may not be deep. Grade 4 pinch test. Extreme pinching of the skin and subcutaneous tissue, and they will stretch as far as 4 centimeters or more. Classification of labia majora flaccidity and treatment guidelines. In the following table, we can find a summary of the different grades of flaccidity with their potential treatments. Grade 1, treatment, PRP, carboxytherapy, radiofrequency, laser, ultrasound, and stem cells. Grade 2, PRP, thread lift, radiofrequency, laser, carboxytherapy, fat grafting, fillers like hyaluronic acid. Grade 3, lifting, fat grafting and thread lift, radiofrequency, laser. Grade 4, lifting and fat grafting, laser or radiofrequency, and fat grafting. Flaccidity grade 2, for which autologous fat implants were applied to the lips and threads were employed to decrease the sensation of sagging. Lip asymmetry, which could be seen while the patient was standing, was not evident when performing the full assessment in the lithotomy position, but it was troubling the patient. Flaccidity grade 2 and 3. Lifting of the outer lips is done with CO2 laser. Flaccidity grade 4 is evident here. It was first handled with radiofrequency to achieve a grade 2, from which to blend the treatment with fat grafting. Assessment conclusions. The patient's expectations towards the treatment and desired results are important, whether she would rather non-surgical procedures or is willing to undergo surgical treatments. It is essential to bear in mind that sagging in this region can stem from the skin as much as from the subcutaneous cell tissue. The patient must always be assessed from both the standing and the lithotomy positions. Treatment conclusions. We should be mindful not to always offer the filler technique from the start, especially in flaccidity grades 3 and 4. We advise against pointing to lifting surgery for flaccidity grade 1. Even though there is a plethora of treatments for outer lip sagging, having a classification allows us to employ them properly. As a result, we avoid multiple unnecessary treatments.